Assalamu alaikum. Starting with the name of Allah. Let me introduce myself. I am Muhammad waqas, student of BS MLT 8th semester. My registration number is MLT120192038. The teacher of the subject is Dr. Niaz Muhammad at Department MLT called University of Science and Technology. Today the topic of my presentation is herpes virus. The outline of the topic is introduction, epidemiology, structure and properties of HSV, route of transmission, oral and genital infection, other areas infection, signs, symptom, diagnosis and treatment. Introduction. Herpes simplex is a word from Greek language meaning creeping or latent. After primary infection, it enters the nerve of the site of the primary infection, migrates to the cell's body of the neurons and becomes latent in the ganglions. It is one of the 8 following human herpes belonging from the family Herpesviridae. Herpes simplex virus type 1 and type 2, varicella zoster virus type 3, Epstein-Barr virus, cytomegalovirus, human herpes virus 6, 7, 8, associated with toxoplasmosis sarcomas. Epidemiology of HSV. Worldwide rate of both HSV1 and HSV2 is 60 to 95%. HSV1 is more common than HSV2 with rate increasing with age. HSV1 is 70 to 80% in low socioeconomics and 40 to 60% in improved socioeconomic status population. HSV2 prevalence is 16% of population in 2003. In USA, 57.7% of population is infected with HSV1 and 16.2% infected with HSV2. Herpes viruses have a unique 4-layered structure, a core containing the large double-stranded DNA genome which is enclosed by an icosa pentahedral capsid which is composed of capsomers. The capsid is surrounded by an amorphous protein coat called tegument. It is encased in glycoprotein-bearing lipid bilayer envelope. Herpes simplex virus is invalid double-stranded DNA virus. Genome consists of long and short fragments which may be oriented in either direction, giving a total of 4 isomers. Size of HSV is 120 to 200 nanometers. It is divided into 3 subfamilies. All are structurally similar: alpha herpes, beta herpes virus, and gamma herpes virus. Most of the time when herpes simplex virus or HSV infect a person, there are no symptoms. In fact, it also usually moves from one person to another in the absence of symptoms. So therefore it can move through a population silently. Once in a while though it can cause symptoms, and typically those are in form of skin and mucous membranes lesion, which can be divided into infections above the waist involving the mouth and tongue, and those below the waist involving the genitals. There are 2 types of herpes simplex viruses, HSV1 and HSV2, both of which are part of large family of enveloped DNA viruses, the Herpesviridae family. Generally speaking, HSV1 tends to cause infection above the waist and HSV2 tends to cause infection below the waist. But there is a lot of crossover because both viruses can cause both type of infection. Although herpes is most contagious when there are virus-filled lesions present, it can also spread by asymptomatic shedding, which means that herpes viruses can be in saliva or genital secretion even when there is no signs of cold sore or genital lesions. Typically when herpes virus land on the new host, in other words a person that never had herpes before, it dives into the small cracks in the skin or mucosa and bends to epithelial cell receptor, which trigger those cells in internalizing the virus. Once inside the virus, start up the latex cycle, which is where its DNA get transcribed and translated by cellular enzymes, which help to form viral protein which are packaged into new herpes viruses, which can leave to go off and infect neighboring epithelial cells. HSV1 and HSV2 also infect nearby sensory neurons and travel up their axon to neuron cell body to start up the latent cycle. The sensory neurons of the face have their cell bodies in trigeminal ganglia, and those around the genitalia are located in the sacral ganglia. So that's ultimately where the herpes virus settle in for life. You see the sensory neuron and destroy. Instead, they become a permanent home for the herpes viruses. And from time to time, the herpes virus makes a few viral copies of itself and send those virus particles back down the axon so they can get released and infect epithelial cells. Since the trigeminal and sacral ganglia serve just one side of the face or body, herpes vesicle and ulcer develop on the ipsilateral or same side as the affected ganglia. This can happen over and over again throughout a person's lifetime, with classic triggers being things like stress, skin damage, and viral illnesses. Recurrent episodes are usually less severe than the primary infection, and sometimes there are no symptoms at all. When there are symptoms, there might be a characteristic tingling or bruising sensation called a prodrome 1 or 2 days before the blister appear. The route of transmission of herpes simplex virus is usually transmitted in saliva and in other secretions of the body. HSV1 usually transmitted in saliva, kissing, sharing of glass, etc. And HSV2 transmitted by sexual contact. HSV can infect genitalia, anorectal tissue, or the pharynx. Autoinoculation during pregnancy and labor, both types can cause oral and genital lesion. In oral and genital herpes, the primary infection is most often asymptomatic. Having said that, in oral herpes, when it does cause symptoms, it usually affects children. It causes lesion on the palate, gums, tongue, lips, and facial area, as well as a fever and enlarged lymph nodes. The lesions themselves are typically clusters of small, painful, fluid-filled blisters that oozes and ulcerate, and then eventually heal after a few weeks. In older children and adults, a common symptom is pharyngitis. Most of the time, like primary infection, reactivation doesn't cause any symptoms. But when it does, the most common pattern is having a handful of blister at the vermilion border, the border of lip on the one side of the face. The blisters are typically smaller and heal over a week. With genital herpes, primary infection can cause symptoms like ulcer and pustulates, which form on the labia majora, labia minora, mons pubis, vaginal mucosa, and cervix in the woman, and on the shaft of the penis in the man. Like oral herpes, most of the time reactivation doesn't cause any symptoms, but when it does, the most common pattern is to have a few blisters that resolve rapidly in a week. In addition to oral and genital infection, HSV can also affect other areas. When it affects the fingertip or nail pad, it's called herpetic whitlow, and this might happen if the finger rubs up against an active lesion around the mouth or genital areas. Once it affects the fingertip, it's also easy for it to get carried over to other areas of the body to spread the infection, a process called autoinoculation. HSV can sometimes involve in the trunk, extremities, head, a pattern that common among wrestlers because they have a lot of skin-to-skin contact, and therefore it's called herpes gladiatorum. Finally, individuals with burn injuries or with atopic dermatitis can have really serious herpes infection in those areas. The latter even has a specific name, eczema herpeticum. HSV can also affect the eye, causing keratoconjunctivitis, which is inflammation of both the cornea and the conjunctiva. In addition to the symptoms of conjunctivitis, which are pain, redness, tearing, and sensitivity to light, there can also a classic signs of corneal involvement like blurry vision and branching dendritic lesion, which look a bit like tree-like dendrites of the neuron, which happen on the cornea itself, and this pattern is classic for herpes infection. In rare cases, herpes viruses can spread to the central nervous system and cause meningitis or encephalitis, typically affecting the temporal lobe in individuals of all ages. These can happen for a primary infection, but more commonly happen during reactivation, when some of the virus can escape into the bloodstream and reach the brain. When there is brain involvement, a lumbar puncture often has a specific finding like an increase in red blood cell, increase in white blood cell, and elevated protein levels. There are also some CT, MRI, and EEG changes that can help to make the diagnosis. HSV can pass from a mother to a baby rather than causing a congenital infection while the fetus is in the uterus. Most of the transmission happens at the birth, when the baby passes through infected maternal vaginal secretion during delivery. Neonatal HSV causes three different patterns of illness, each occurring about one-third of the time. The first is skin, eye or mucosal membrane infection, where lesions pop up 1 to 2 weeks after delivery, typically at site of damaged skin, like the site where a fatal scalp electrode may have been attached. The second is central nervous system infection, which typically causes lethargy, irritability, and even seizure from 2 to 3 weeks after delivery, and can cause some of the same lumbar puncture, CT, MRI, and EEG finding as that in older children and adults with HSV encephalitis. If not treated, both the first and second type can transition into third type, which is disseminated infection, where herpes virus infection causes sepsis and failure of the various organs, including the heart and brain. HSV can cause unique symptoms in immunocompromised individual, who tends to have more frequent reactivation, more severe symptoms, and a wider range of symptoms, like lesion in the esophagus of the lungs. Sign and symptom: a viral infection causing painful sore in the skin around the mouth and genitalia. Stages: prodrome stage, symptoms less but highly contagious. Might experience pain and burning, fever, headache and swollen lymph nodes, lymph glands or nodes. Blister development stage: virus reach skin surface, small red fluid filled bumps seen in clusters. Ulcer development stage: blister collapse to form ulcers. They are painful, red and oozy, eventually form crust on scab on tops. Healing ulcer stage: it takes around 2 to 4 weeks to heal. Might bleed if the scab gets cracked. Removing crust gives a scar on skin permanently. Herpes can usually diagnose based on how the skin or mucous membrane lesion look, and can be confirmed with tests looking for viral DNA like polymerase chain reaction and antibody response to the virus, or by growing the virus with a viral culture. Although infection typically resolves without treatment within a couple of weeks, there are antiviral drugs like acyclovir, famciclovir and valacyclovir that can be used topically or systemically to reduce pain and speed by healing. For recurring episodes, these treatments usually work best if taken when the prodrome stage starts. In other words, before the blister develops, and high dose intravenous antiviral may be given in more severe and threatening situations. Thank you very much for listening. If you have any question, you may ask.